Let's start our case study about complex partial seizure. We have in this case a 59-year-old physician who presents with a chief complaint saying, "I think that I'm having partial seizures." And the manifestations included episodes of unresponsiveness where the patient stares off into space and fidget with his thigh. The episodes last 3 to 4 minutes each time. The episodes are preceded with a soap taste in the mouth. That's what we call aura. Following the episodes, the patient felt confused and unable to speak clearly for some time. This is what we call post-ictal phase. Identify the patient's complaints that are consistent with a diagnosis of complex partial seizure activity. The manifestations, as we can identify them in the case, there is no response during the attacks. During the attacks, the patient was unresponsive and the patient was staring off during an attack, and the episodes lasted 3 to 4 minutes. Never more than 5. If more than 5, we call it status epilepticus. The patient maintains consciousness during seizures, but he's not responsive. By this word, maintains consciousness, he could hear you. He could hear you, but he's not responsive. He could hear you, but he's not responding. Fidgeting during seizure, which is the motor automatism. Repeated movements, motor automatism. Confusion when the attack subsides, post-ictal. Incoherent speech following an attack, post-ictal. Amnesia about the attack, post-ictal. Aura of soap taste. As I said, the aura or any sensory experience that usually precedes the actual seizure could be olfactory, could be visual, could be auditory. Here it is in the taste, soap taste in the mouth. The patient senses loss of time after the seizure, and patience is exhausted after a seizure. All these are manifestations of complex partial seizure activity in this patient. What is the cause of the seizure activity in this patient? Actually, it turned to be a brain tumor in the left temporal lobe, as the case study tells us. This patient had brain tumor in his left temporal lobe detected by CT and MRI. Do brain tumors have to be malignant to cause seizures? And the answer is absolutely no. Brain tumors do not necessarily need to be malignant to cause seizures. It depends mainly on the space-occupying lesion rather than the pathology of the brain tumor. So brain tumor, whether benign or malignant, still can cause seizures. If this patient reported that TIAs, transient ischemic attacks, were accompanying seizure activity, what might have been a possible cause of recurrent complex partial seizure? Transient ischemic attacks means what? Short-term attacks that suggest cerebrovascular disease, some deprivation of the brain of its blood supply. It's going to lower the blood flow to the brain. Cerebrovascular disease due to atherosclerosis is a common potential cause of seizures in older individuals. So this is the pathology of seizures here, inadequate cerebral perfusion. The second case study is generalized tonic-clonic seizure. And here we have a 17-year-old boy brought to the ER by his high school football coach, who said his arms and legs were as rigid as lead pipes. His eyes were rolling and he was shaking all over. And the entire episode lasted for 3 to 4 minutes. The boy woke up confused with no recall of the attack. So identify 2 contributing factors to the patient's seizures. From the case, we know that these 2 contributing factors are the patient history of head trauma when he was younger and concussion, and positive family history of epilepsy. Very important. Family history in seizures is a very important contributing factor. What are the clinical manifestations in this patient that are consistent with the diagnosis of grand mal seizure or the generalized tonic-clonic seizure? The patient suddenly fell to the ground at onset of episode, loss of consciousness and muscle rigidity. These are very important. Period of apnea, period of absence of spontaneous breathing. This is very brief period due to this muscle spasm. Shrill or cry cry coming from the contraction of the thoracic muscles that push air forcibly, and this will give this characteristic cry. Violent rhythmic muscle contractions and hyperventilation. Eyes were rolling, face became grossly contorted, and progressive decrease in jerking movements. Entire episode lasted up to 4 minutes, and the patient had no recall of what happened during the seizure. And following the attack, the patient was confused, post-ictal. Following the attack, the patient complained of headache and sore muscles. The patient reported feeling weak and tired after the incident, and the patient reported possible prodromal period of lightheaded feeling earlier in the day. What's the importance of the chest exam, lung exam results in any patient who had a seizure? It's very important to examine the chest. Why? Because of this. The patient could have aspirated during the attack of seizure or during convulsions. That's why you need to exclude aspiration pneumonia. You need to do chest lung examination for this important reason. Patients who undergo a tonic-clonic seizure often aspirate. Therefore, this is very important to exclude aspiration pneumonia. What's the single most important lab result that may have contributed to the patient's seizure? And here it's going to be the electrolyte imbalance. Low serum sodium concentration. Hyponatremia that this patient got probably because of excessive sweating during exercise. Hyponatremia is one of the precipitating causes of seizures. What do you consider the most appropriate initial treatment trial for this patient? You can try valproic acid for the long-term management of this patient. Okay, one final question. Are the terms seizure and convulsions synonymous? Actually, we use them interchangeably, although they are not synonymous. So a seizure, as I said, is sudden, explosive, disorderly discharge of cerebral neurons, just excessive neuronal activity, where convulsions refers to excessive motor activity, manifestation, muscular, motor manifestation of a seizure. So some types of seizure, however, are not characterized by excessive muscle contractions and motor activity. So more simply stated, not all seizures result in convulsions.